In this lecture, we'll be talking about conducting an interview assessment with clients. Assessment is a way of identifying and defining a client's concerns. So we use assessment number one to figure out what are the client's concerns, and then you collect additional information to help you get a clearer picture of what is concerning your client. Then you use the information collected from your assessment to make decisions about therapeutic treatment. Now, there are a number of different ways to assess client behaviors. The first would be standardized tests. These would be things like IQ tests, achievement tests, tests of memory or other cognitive functions. Next, you have a psychophysiological assessment. So here you are measuring or assessing some part of your client's physiology. So it could be something like measuring heart rate or blood pressure as an indicator of anxiety. You could also do something like if, for example, your client suffered with chronic headaches, measure their muscle tension using something like an electromyograph machine. Another method of assessment would be self-report checklists. And this is where the client is reporting on their behavior in some area. So these could be things like assertiveness scales, anxiety inventories. So if you were administering an assertiveness scale to your client, there may be a question like, I speak up for myself when I feel that somebody has wronged me. And they could score themselves on a Likert scale. So the scale could go from never, rarely, occasionally, often, and always. And so they would rate themselves in the area of assertiveness using that Likert scale. Next, you have observation by others. And this is where others, including yourself, make observations of the client. So you, the therapist, of course, will make behavioral observations throughout the assessment, but then you can also, with the client's permission, collect observations from other relevant people in their lives. So very often, if you're working with children, you'll have parent and teacher observations of the child as well as your own. Next, you can ask your client to engage in some form of self-observation. And this is where they're observing and recording some aspect of their behavior. So you may ask your client to record the number of times a day they have thoughts about their health. Maybe they have, hypochondriasis or something where they're overly concerned about their health. So you have them record the number of times a day they worry about their health. You may also have a client who is suffering with pain, and you have them keep a pain log where every time they experience pain, they record the time the pain was experienced, the duration of the pain, and how intense the pain was. And finally, you have direct interviewing. And this is where the client and the helper identify concerns through verbal and nonverbal exchanges. So you're having a conversation with the client, you're assessing them through their verbal communication as well as their nonverbal communication. And so in this particular chapter, we're going to focus on direct interviewing. So direct interviewing is also referred to as assessment interviewing. Some things to keep in mind. You do not want to rely solely on the interview for assessment data. You want to use several methods of obtaining information about clients. So in addition to doing your assessment interview, you want to, of course, have your own behavioral observations of the client. But you may also want to include things like self-report checklists where they're rating themselves on whatever their particular area of concern is. You may have them do self-observations where they're recording the frequency or duration of the problem behaviors. And then you may also want to, gather observations from other relevant people in the client's life. And you also have to remember that direct interviewing relies on client self-report. So how accurate and reliable your assessment is based on how accurate and truthful what the client is telling you is. So if the client is giving you information that's not truthful or information that is not accurate, your assessment is not going to be accurate and reliable. So as you're doing your assessment interview, you want to make sure that you note the client's demeanor. How do they carry themselves? Do they appear to be confident? Do they appear to be depressed? Are they manic? Are they, um, shameful? So you want to look at their overall demeanor. How is their grooming? Do they appear to be clean? Is their hygiene good? Are their clothes, um, basically clean and unrumpled? How is their overall grooming? What is their activity level? Do they appear to have a normal activity level? Are they alert, or is their activity level unusually low? Um, are they overly active? Do they appear to be having some type of psychomotor agitation, or maybe even some like manic type behaviors as far as their activity level goes? How is their attention span? Are they able to attend to your questions? Are they able to remain attentive throughout the session? How is their speech? How is their vocabulary? How is their rate of speech? Is their speech logical? And then, of course, look at the nonverbal behaviors. What is their body language? What type of gestures are they using? What is their facial expression like? So while you're interviewing your client, having these verbal exchanges, you also make sure that you're observing all of these nonverbal communications as well.